If your cat stopped breathing right now, not tomorrow, not someday, right now in the next 60 seconds, you would not have time to search for a video. You would not have time to call anyone. You would have exactly the amount of knowledge already in your hands, and nothing more. Most cat owners who have sat in that moment describe the same thing afterward. Not grief first, panic first. A complete, total shutdown of every instinct they thought they had in the exact window where the right action taken immediately could have changed the outcome entirely. This video exists for that window, not to frighten you, to prepare you for it before it arrives, because it will arrive for every cat owner eventually, and the difference between knowing and not knowing in that moment is not small. Let me start with the thing most cat owners never do until it is too late. A basic vital signs assessment on a calm, healthy cat. You need to know what normal looks like on your specific animal before you can recognize what wrong looks like. Your cat's femoral pulse is found on the inner thigh where the leg meets the body. Press 2 fingers gently into that groove and count the beats for 15 seconds, then multiply by 4. A healthy resting cat heart rate falls between 100 and 140 beats per minute. If you have never done this on your cat before, do it tonight. Not because anything is wrong, because the moment something is wrong, your hands need to already know where to go without your brain having to direct them. Gum color is the second vital sign most owners have never checked, and the one that tells you the most in an emergency. Lift your cat's lip and look at the tissue above the teeth. Healthy gums are pink. Bubblegum pink, not pale, not white, not blue, not gray. Press your finger firmly against the gum tissue and release. The color should return within 2 seconds. That 2-second capillary refill time tells you whether blood is circulating adequately to the extremities. Healthy gums are pink, bubblegum pink, not pale, not white, not blue, not gray. White or gray gums with a refill time above 2 seconds is a circulatory emergency. Blue gums mean oxygen is not reaching the tissue. Both require immediate action and simultaneous transport to a veterinary facility. Before you touch a panicked or injured cat, understand what is about to happen to the animal's nervous system. A cat in acute pain or severe distress is not the cat you know. The brain has switched entirely to survival mode. Every stimulus is a threat. Every touch is a potential attack. Approaching from the front, making direct eye contact, or reaching directly for the injured area will almost certainly trigger a defensive response that results in injury to you and additional stress trauma to the animal. Approach from the side. Keep your body low. Speak in a monotone, continuous voice, not to communicate words, but to provide an unbroken auditory signal that something calm is present in the environment. Drape a large towel over the cat before attempting to move or examine it, not to restrain forcefully, but to reduce the visual stimulus load. And give the animal something to press against, which activates the same calming pressure response used in professional veterinary handling. Now the scenario most owners are completely unprepared for: arterial bleeding, not a small cut. Active, heavy bleeding from a wound that is not stopping on its own. The mistake almost every untrained owner makes is applying pressure and then immediately lifting the material to check whether the bleeding has stopped. Do not do this. Every time you lift the compress, you are disrupting the clotting process that has already begun. Apply firm, direct pressure with the cleanest material available, ideally sterile gauze, realistically a clean cloth, and hold it without lifting for a minimum of 3 to 5 minutes before assessing. If the material soaks through completely, add additional material on top without removing what is already in place. If the wound is on a limb, and the bleeding is severe enough that direct pressure is not controlling it, a makeshift pressure bandage using a strip of cloth wrapped firmly above the wound site can reduce blood flow, while transport to emergency veterinary care is arranged. This is a temporary measure only. It should never remain in place beyond 15 to 20 minutes without professional intervention. Choking is the emergency that moves the fastest and gives the owner the least time to think. If your cat is pawing at its mouth, making repeated swallowing attempts, producing high-pitched distress sounds, or showing blue gum coloration, the airway may be partially or fully obstructed. Open the mouth by placing one hand over the top of the skull with the thumb and forefinger behind the upper canine teeth, and use the other hand to gently depress the lower jaw. Look directly into the throat with a light source if available. If you can see a foreign object and it is reachable without pushing it further into the airway, attempt removal with 2 fingers. If you cannot see or safely reach the object, a modified Heimlich maneuver for cats involves holding the animal with its back against your chest, finding the soft area of the abdomen just below the rib cage, and applying 5 firm upward compressions. This is a last resort measure before transport, not a substitute for veterinary emergency care. Feline CPR is the procedure most owners have heard of and almost none have practiced. The compression rate for a cat is 100 to 120 compressions per minute, faster than most people instinctively apply. For an adult cat, place the animal on its right side on a firm surface. Cup one hand over the chest, just behind the front legs at the widest point of the rib cage. Compress down approximately 1/3 of the chest depth and release fully. Allowing the chest to fully recoil between compressions is as important as the compression itself. Every 30 compressions, provide 2 rescue breaths by closing the mouth completely, forming a seal around both nostrils with your mouth and exhaling gently, because cat lungs are small and overinflation causes additional damage. Continue the 30 to 2 cycle without stopping until the animal breathes independently or until you reach a veterinary facility. Do not stop to assess for pulse during active compressions. Keep the cycle running continuously. Fractures and suspected spinal injuries require a different approach entirely, one where the instinct to comfort the animal by picking it up is the exact response that causes the most additional damage. A cat with a suspected spinal injury must be moved on a rigid surface, not lifted. A cutting board, a hardcover book, a piece of cardboard firm enough to support the full body length. Slide the animal onto the surface rather than lifting, keeping the spine as aligned and unrotated as possible during transport. Improvised splinting for limb fractures uses the same principle as human first aid. 2 rigid objects on either side of the injury site, wrapped firmly enough to immobilize but not tightly enough to restrict circulation. The test for circulation after splinting is the same gum color and capillary refill check described earlier. Poisoning is the emergency that often presents last and is recognized too late. Cats are physiologically unable to metabolize several compounds that are harmless or even beneficial to humans. Lilies in their entirety are nephrotoxic to cats at trace exposure levels, meaning a cat that has simply walked through lily pollen and groomed its fur has been exposed. Acetaminophen in doses that would be therapeutic for a human is acutely fatal to a cat. Xylitol, the sweetener in sugar-free products, produces hypoglycemic crisis, recognizing the early signs of toxic exposure: excessive salivation, uncoordinated movement, dilated pupils, vomiting, or sudden behavioral change. And having the ASPCA animal poison control number already saved in your phone before you need it is the difference between an outcome that is manageable and one that is not. The gap between panic and action in a feline emergency is not closed by courage or by love for the animal. It is closed by the specific knowledge of what to do next, practiced and internalized before the emergency happens. A cat owner who has checked their animal's femoral pulse and gum color tonight, who knows where their hands go in a choking scenario, who has watched the compression depth for CPR until it is stored somewhere more reliable than conscious recall, that owner is not a veterinarian. But in the 60 seconds before a veterinarian is reachable, they are something more valuable. They are the difference.